Okay, so if you are in the pre-professional category, you're taking this class because you want to be a doctor, a nurse, a PA, a dentist, or if you just want to work with patients in general, yeah, pretty much all of your job can be summarized in what I'm going to talk about in one video. Hey, you've done it. You're ready to work with patients. But realistically, your entire job boils down to maintaining homeostasis. So homeostasis is the stable internal environment for the body, and each thing has its own homeostatic set point. So homeostasis really is your goal. So I always think of it like a little box. There's a range for everything that you just want to stay within. And anytime illness or death happens, it's because there's a deviation from homeostasis. I mean, I think it would probably make all of those cop shows really boring when they're like, what's the cause of death? And the status is always like, deviation from homeostasis. But you could say that. It's legit. So let's talk about how do we maintain homeostasis? Well, the main way to do that is the negative feedback loop. So a negative feedback loop, the basic idea is anytime you fluctuate from homeostasis, you will notice that change and then you're going to counter it. So let's say the problem is you have an increase in maybe salt. Well, what's our solution? Get rid of the salt. Lower the salt. If you have an increase in blood pressure, lower your blood pressure. If you have too much calcium, store it. If you don't have enough water, get thirsty, go get more. Save what you have. And so every chapter that we go through, when we start talking about each of the organ systems, there will be one of these loops. So I'm going to teach you the blueprint today. And then every chapter, you can just apply that blueprint to whatever variable that chapter is talking about or that system's in charge of. So first off, let's do the blueprint of what's actually happening. And so the first thing that'll happen is you're going to have a change outside of this little box, outside of this range. So we'll have a change occur. Now in our body, the things that pick up or notice change are receptors. And each receptor is set up to notice specific changes. So whenever you get into new feedback loops, you might be learning the names of those receptors. If it's a blood pressure one, it might be a stretch receptor built into the wall. If it's a change in, like we were talking about, calcium levels, that would be a chemical. So there would be chemical receptors built into the walls of like our blood vessels. If it's, we could do a change in temperature. We'll do that in this video. So we'll have a thermoreceptor. So they're specific to whatever that change is. So the receptors will notice, we've left the little safety of our box. Do you think they can fix it? No, they're just monitoring. Their job is just to notice what's happening out there. So they got to talk to somebody that can understand it. And so they're going to go to a control center. A control center is typically going to be a nervous tissue or an endocrine structure. So you're dealing with some communication component here for that control center. So they're also going to relay stuff out. Because again, if it's a nervous tissue, like the brain's not solving the problem. They're just interpreting like, oh, I noticed that you're too high in sodium. And then let me go talk to somebody and get help with that problem. So think of it kind of like middle management. Now they're going to go talk to the workers who actually can do something about that issue. And those workers will be our effectors. So effectors are things that are capable of causing change, typically going to be glands or muscles. And then they will cause a solution. The solution is always going to be the opposite of the change. So let's do an application one. Let's talk about temperature then. So if we have, let's go, I'm a little warm because I'm under all these lights. Let's do that one. So let's have our change. We have an increase in temperature. Somebody's got to notice that change. So we're going to use thermoreceptors. And those thermoreceptors can be spread out. We do have the ability to identify change in temperature in our skin, but the place that we're really protective about is the brain. So your main thermoreceptors are going to be in the hypothalamus of the brain. It fit. Sorry. Okay, now those thermoreceptors are going to report to the control center. Now, conveniently, we are in the brain for the receptors, but that's not always the case. Sometimes those receptors are out in the periphery, and then the control center is up in the brain. For example, you'll see that when you do blood pressure. We'll have receptors out in the blood vessels. Well, not down there, more up here, but you'll have them in the blood vessels, and then you'll send that information up to the brain. But we're already at the hypothalamus, so we're going to use a temperature control center in that hypothalamus. And then they're going to send out commands. Now, since this is a nervous system structure, the arrow right here is actually going to be nerves. Now, I'm not going to make you learn the names of the nerves, but that's what this arrow is. This arrow is always either going to be a nerve or it's going to be a hormone, because that's how we communicate. So we're going to communicate to an effector. Now, in the case of being too warm, what can we do about it? Because remember, the overall goal with the solution here is to be the opposite of this side. So if we have an increase in temperature as our problem, our solution is to decrease temperature. How can we do that? Well, we could sweat. So sweat glands, that would be an effector. So you're going to activate those. You'll also notice that when you feel warm, your skin will start to look more pink, because what's happening is we're going to try to have some of that heat radiate off the body. So the blood vessels that are closer to the surface are going to start to vasodilate. That means they're going to get bigger. So we can send the blood out there. Because if you never notice, the opposite would happen if you're too cold. You would vasoconstrict, and then you would start to look pale, and you're sending that warm blood to the core. Your blood holds a lot of your temperature because it's water. Water holds heat really, really well. And so we're going to send that blood out to the periphery so then we can have some of that heat evaporate out. Okay, so your other effector would be those superficial blood vessels. And then in this case, they're going to vasodilate. Which is just a fancy way of saying they open up and you have more blood go to those areas. So that way then the heat can radiate off, and that will lower your temperature. Now, the really nice thing about a negative feedback loop is once you understand it for one direction, all you do for the other direction, the other problem, is just do the opposite. So if you have an increase in temperature in this loop, if you want to solve it the other way, if you have a decrease in temperature, you just do the opposite, right? We turn this to a down arrow, decrease in temperature. You're still using thermoreceptors. Your control center is still the temperature control center in the hypothalamus. You are still going to talk to similar things, but instead of activating the sweat glands, you would inhibit them. Instead of vasodilating and opening up those superficial blood vessels, you would constrict them. And that would help raise our temperature, because we're going to send that blood to the core. We're going to stop sweating. We could even have an extra effector in the case of being too cold, which is shivering. We can go to our skeletal muscles and start kind of generating heat by activating those muscles. So really nice thing with a negative feedback loop is once you get one side down, you've really done the bulk of the work. And it's always sticking to the same blueprint. So negative feedback loops maintain homeostasis. There is something called a positive feedback loop, which a lot of students get a little stuck on, because I think we get used to the idea of negative being something that's bad. But in the case of negative feedback loop here, what you're doing is you're just negating or opposing a change. So if something happens, you do the opposite, make it go away. So think of it like you're subtracting. So whatever your change is, subtract to get back to normal. A positive feedback loop is a building loop. So in a positive feedback loop, you have a change that you'll build off of. So with that change, you'll notice, and you're like, ooh, wait, I need to do more of that. Now this is an example of like a mom during birth. There's a contraction. That's a change. It's not normal. Doesn't happen a lot. But then we're like, oh wait, we need to do more of that because we want to push the baby out, because those contractions are from the uterine wall trying to help provide force to push the baby out. So we'll have our change, and then it'll build, and we'll do another contraction, and then another contraction, and then another contraction, and it's building, building, building. So you think of like adding on each step. So it's a positive feedback loop. Versus over here, you're going back in a circle. You're turning things off. So this is your negative feedback loop. This would be positive feedback. And the goal here, so we're building contraction, 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 is to get to an outcome. In this case, baby being born. Another example would be forming a blood clot. You start to get some of these cells stick together, and then they'll call in more cells, and they'll call in more cells until you form the blood clot and you're no longer bleeding. So that's a positive feedback. Build, build, build till you get an outcome. Negative feedback, notice a change, subtract that change to get back to stay within homeostasis. All right, so those are your differences on feedback loops. Hopefully that was helpful.